Stem cell therapy, specifically Hematopoietic Stem Cell Transplantation (HSCT), is a crucial treatment for some cancers, notably blood cancers like leukemia, lymphoma, and myeloma. It involves replacing damaged or destroyed blood-forming stem cells with healthy ones, often from a donor or the patient's own body, to restore the patient's immune system and blood cell production. How stem cell therapy is used in cancer treatment. Restoring blood cells. High-dose chemotherapy and radiation therapy, often used to treat cancer, can damage or destroy bone marrow and other healthy cells. Stem cell transplants replenish these cells, allowing the body to produce healthy blood cells including white blood cells, red blood cells, and platelets. Treating specific cancers. Stem cell transplants are commonly used for leukemia, lymphoma, multiple myeloma, and some solid tumors like neuroblastoma and Ewing sarcoma. Allogeneic versus autologous transplants. In allogeneic transplants, stem cells are sourced from a donor, related or unrelated, while autologous transplants use the patient's own previously harvested stem cells. Potential for future therapies. Researchers are exploring the use of stem cells to target cancer stem cells, which are thought to be responsible for cancer recurrence and drug resistance. Additionally, stem cells are being investigated as delivery vehicles for targeted cancer therapies, potentially delivering drugs directly to tumors. Important considerations: graft versus host disease, GVHD. This occurs in allogeneic transplants when the donor's immune cells attack the recipient's body. Side effects. Stem cell transplants can cause various side effects, including low blood cell counts, infections, bleeding, anemia, and digestive issues. Engraftment. This is the process where the transplanted stem cells successfully integrate into the bone marrow and start producing new blood cells. Success rates. Stem cell transplants for blood cancers can achieve success rates of 60 to 70%, with some sources reporting higher overall survival rates 3 years post-treatment.